Thank you so much, Emily. So good to see you, and how exciting on a day where we can celebrate Medicaid. I just want to say that every speaker before has been so inspiring, and certainly loved hearing from Stacey Abrams. But I also want Callie to know you're giving us just as much inspiration by telling your story. It matters so very much. We know that Medicaid is a foundational program. Millions of people get access to their care, and they deserve this access to the care. We want to be the country where they have access to the services that they deserve. So today, as we celebrate 55 years of the life-saving program in the midst of the COVID-19 pandemic, we have to remind ourselves just really how crucial this program is. There's over 65 million people on Medicaid, including in my own family. So I hold dear the stories of Callie and so many Black women who understand how much this program really does affect us. Groups who have been systemically barred from healthcare, women of color, young people, transgender, non-binary people are more likely to have low income and more likely to use Medicaid to get the health care they need. So unfortunately, due to structural racism, there have been too many barriers, health and economic barriers put up for Black and Latinx people in this country who do rely on Medicaid, roughly 1/3 of Black and Latinx people compared to about 15% of white people. So it's no coincidence that Black and Latinx and Indigenous people are suffering, mostly during this pandemic. We know that they are also the essential workers in low-wage jobs who are becoming infected and unfortunately dying at higher rates. Medicaid is the help that people need. It helps to serve a wide range of services, and one of the most prominent services that they provide is sexual and reproductive health care, including prenatal care, birth control, STD testing. Medicaid allows people to manage their health, to plan their future. More than half of the people that are seen at Planned Parenthood health centers in this country are relying on Medicaid to get access to the care. In general, women, and particularly women of color, make less money than men because of pay inequity, and therefore are more likely to qualify for Medicaid. For example, for every $1 a white man makes, on average, a white woman makes 79 cents. A Black woman, however, makes 63 cents, and a Latina makes 54 cents. About 1 in 5 women of reproductive age rely on Medicaid in their healthcare. 1 in 5. That means they're people, these are folks we know. These are our people, our communities. Women account for over half of the adult Medicaid enrollees. In fact, Medicaid covers more women's healthcare services than any other payer, and it is the largest payer of reproductive healthcare coverage, paying for nearly half of all births in the United States and 75% of publicly funded family planning services. So at its core, we should remember that Medicaid is a women's health care program, and because of wonderful advocates like Emily and the long work that she has been able to do, we know that we really have to help people understand when we're talking about Medicaid, Medicaid is a women's health program. As we continue to face this dual public health crisis of COVID-19 and systemic racism, more and more people are going to need Medicaid in order to get access to essential care services. And yet, unfortunately, the Senate majority's recent proposal does nothing to help more than 5 million people who have lost health insurance to expand Medicaid coverage. And meanwhile, 13 states have still refused to expand Medicaid, leaving millions without health insurance. And this is just not acceptable. It's during unprecedented times like these where access to healthcare coverage through Medicaid is essential. It's for our healthcare. Medicaid is helping to save lives, and it is key to ensuring people are able to, in this moment, endure a financial crisis and make sure that the economy can fully recover. We can do that by investing in Medicaid, and now more than ever, it's really critical to protect all of us. We work to advance racial equity in this country and ensure that we can protect access to reproductive health care. This is an issue that simply cannot wait, and thank you so much for having Planned Parenthood Action Fund join you today.